to start off by going through the slides. I do have quite a bit of slides, so bear with me. So, Ms. Louisa has done an excellent job on the background, so I'm not going to kind of go into too much about it. So why do we need to talk about mental health, and why do we need to talk about mental health and numbers and statistics? Because numbers put things in context and give us an objective view on things. So globally speaking, 1 in every 10 children were affected by mental health issues and have a diagnosis. And as the Honourable Seymour has pointed out, suicide is the second highest cause of death in our youth population. So it's very important that we actually understand why. And what is excellent about today's kind of data is that we are going to be able to understand something that is locally applicable and unique to our Cayman Islands. As you can see from the graphs, these are the kind of data that we have collected in the past. And these are the data that understand the suicidal ideation. In 2007, we have about 19% of students in the student survey reported that they have considered attempting suicide. In 2013, the Panton study indicated that 23% of the students have reported experiencing suicidal ideation. Last year, the 2018 Cayman Islands Student Drugs Use Survey, we found that 34% of the students reported that they have seriously considered attempting suicide. So you can see the number is on the increase. What we have done in this survey is that, like Ms. Louisa was saying, we have actually collected, we have expanded the student survey and included parents' family mental health background, the diagnosis of mental health difficulties, and how young people understand the mental health and emotional well-being, feelings about themselves. In particular, what is special about this data that's extremely helpful for us is to identify factors that significantly impact on suicide behaviors in our youth in Cayman Islands. This is not an exhaustive list, but it's a list of what we have extracted from the survey that is available to us. So let's start by having a look at the background information on mental health. Most of the students, 92% of the students said that they actually understood what is meant by mental health, which is good, right? And over half of the students said that they have been taught about mental health in school, part of the curriculum. Excellent. When asked if they have seen a doctor or a nurse or counselor about the mental health or emotional well-being, we have about 28% of the students that they had. But if I actually turn it around and said, only a quarter of our children in a population have seen a doctor about their physical health, would we still agree with the data? Is physical health equally important as our mental health? Diagnosis and mental health. Nearly 10% of the students said that they have been diagnosed with a mental health illness. As you can see, we have the percentage slightly more in girls than boys. And this is self-reported data, by the way. Nearly 6% of the students said that their parents have suffered a mental health illness. This is kind of similar to our international data. Worldwide, we have about 10 to 20% of the children and adolescents experience mental health disorder. Anxiety disorder is the most frequently diagnosed disorder in children, followed by behavior disorder, mood disorder, and substance misuse disorder. So we're going to look at how the young people describe their mental health. Over 3/4 of our young people describe their mental health positively. And boys tend to describe their mental health as excellent than girls. Feeling about themselves. Overall, more than 75% of the students said that they're happy with themselves, while 23% said they're not. Dr. Douglas, who's the psychologist who do all the statistic analysis with us at Alex Panton Foundation in collaboration with the National Drugs Council, is that we managed to actually understand our data beyond just percentage and numbers. And what we have done is we actually look at the gender differences in terms of image of themselves and feelings about themselves. And what we actually found is that boys and girls present different kinds of needs, and we want to actually understand how. So you can see, girls actually indicate more dissatisfaction of themselves than boys. And throughout the presentation, you can actually see the comparison data of boys' needs and girls' needs in our community. So we're going to go into more in depth of the mental health data. What we have done this year in collaboration with National Drugs Council, we have embedded a psychometric questionnaire in this survey that looks at the most commonly diagnosed mental health condition in our youth, such as depression and anxiety disorders. The results of the psychometric basically put the data in a range: normal range, borderline, or clinical range. And we usually use psychometric data to support the process of an assessment or diagnosis. We don't solely use psychometric measure on its own. We collect a bunch of data as well. The psychometric data is actually very helpful to give us an overview and give things some context. So what this data actually means is that in the normal range, things are fine. The data and the score actually means that nothing we need to worry about. It's kind of normal within the age. The borderline range, it means that there is some risk of going into the clinical range, but not quite within the normal range. The clinical range is usually meet the cutoff, the threshold of clinical cutoff, meaning that usually a young person would have a diagnosis, in a clinical diagnosis. So for depression, as in clinical depression, 8% of our young people sit in the borderline range, as in at risk. 4% of the young people sit in the clinical range, as in 4% of the young people in 2018 who filled out the survey might have a diagnosis of depression. Girls are significantly more likely to score on the borderline and clinical threshold than boys. Internationally speaking, just less than 1% of the young people would meet the clinical cutoff of depression. 4%. Anxiety. We're looking at anxiety as including social anxiety, panic disorder, phobia, and separation anxiety. So this is an overall representation of anxiety disorders. Again, we're going to look, we're going to look at where the data kind of sits. With 9% of our young people sit in the borderline range. 9% of our young people filled in the questionnaire is at risk of having an anxiety disorder. 5% of the young people would have met the threshold of a clinical diagnosis of anxiety disorder. Internationally speaking, it's about 1% of the young people would meet the clinical diagnosis of anxiety, with 5%. We're going to look at suicidal ideation and suicide attempts here. About 1 in 3 students said that they seriously considered attempting suicide. So it's significantly more in girls in comparison to boys. And the prevalence of actual attempted suicides was about 13% overall. What that means is that there is a difference between attempted suicide and suicidal ideation, and we made the distinction in this questionnaire. Suicidal ideation is if the young person have experienced fleeting thoughts of wanting to end their life, might have a plan or might not. Whereas attempted suicide means that they have actually carried out the plan to end their life. They were just not successful. And this 664 young people last year said that they're seriously considering ending their life. And we have 244 young people actually carry out the plan to try to end their lives. There's significantly more girls than boys. And the survey actually asked them if they have thoughts about getting help from a doctor or nurse after they attempted suicide. Only 5% said that they have thoughts about getting help. And if I actually turn around and said, only 5% of the young people who had had a car crash went into A&E to get help, would that surprise you? Internationally speaking, the World Health Organization data show that suicide is the third leading cause of death among youth in the low and middle income countries. We have about 12 to 16% of the young people experience suicide ideation in the low and middle income countries, internationally speaking. Suicide attempts as in young people who have actually carried out their thoughts of ending their life range between 2.9 to 3.2%, internationally speaking, in low and middle income countries. In Cayman, this is our number. And as we know, men are 3 times more likely to have successfully completed a suicide. Again, we will discuss more of this in our Young Men at Risk Community Workshop this year, which is in collaboration with the Ministry of Community Affairs, looking at the risk factor in our young men and suicide. So we're going to look at self-harm behavior. The survey indicates that 28% of the young people said that they have engaged in self-harming behavior in the last 12 months at the time they were filling in the questionnaire. This is a pie chart that shows the type of self-harm behavior. As you can see, cutting is the most commonly used method, followed by hitting or banging the body parts, scratching and pinching. And then we have burning and other method as well. The worldwide data estimate that young people who have engaged in self-harm in the past 12 months vary between 3 to 21%, because it's kind of hard to make an accurate estimation, because a lot of the time the young people engage in self-harm will admit it or actually want to keep it very private. Again, you can see that girls are significantly more likely to report that they have been engaging in self-harm than boys. What we have done, remember in the beginning I said what this data was really helpful is the in-depth of the statistical analysis that we have done in this survey. What makes it really helpful is the identification of risk factors on attempted suicide in the Cayman Islands of our youth. And this is actually one of the analysis that Dr. Douglas and I have carried out. We actually look at the risk factor of self-harming and how that impacts on attempted suicide. What we found is that students who reported engaging in self-harm were 17 times more likely to have attempted suicide in comparison to those who have not been engaging in self-harm. 17 times. So deliberate self-harm is definitely a risk factor that we should not overlook. Deliberate self-harm, generally speaking, is one of the strongest predictors of suicide. The common behavior has usually started at about age 12 and peak around 15 and kind of go down towards young adulthood. But if we know in the Cayman Islands, that young people who are engaging in self-harm are 17 times more likely at risk that they attempt suicide. We need to do something about it. That's why last year, in collaboration with the Ministry of Community Affairs, we rolled out a series of workshops in management of deliberate self-harm and suicidal ideation. We at Panton Foundation are hoping to carry on doing these workshops in the community. For those of you who want to learn more about it, please visit us at the booth outside. Now, let's look at help-seeking behavior. I'm sure all of you sitting there thinking, oh my goodness, what are the youth doing? There's one good thing. We actually found a protective factors for help-seeking behavior. We found that 85% of the young, 85% of the young people who has been diagnosed with the mental health difficulties or mental health disorder actually seek help of their condition through counseling service, use of medication, or psychological services. So basically what that means is that if the young person has a diagnosis, they're more likely to go and seek help. It sounds like you mean that knowing that you have a difficulty and having a diagnosis is a protective factor in seeking help. The barrier of not seeking help is feeling that they do not need it, not knowing if this is going to be helpful, fear of being judged, and feeling embarrassed to have to seek help and to get help. So for those of us who are sitting out there who are service provider or community worker or mentor or youth leader, we need to think about breaking down those stigmas and encouraging our young people to understand what help seeking means and increase the accessibility of going to get help. So help-seeking behavior. In this nowadays, we know that our young people all have a smartphone, all have access to social media. So we ask the question, where do they seek help in the social media? And this is the breakdown. As you can see, Facebook is kind of out now with our young people. Instagram, Snapchat, and WhatsApp is kind of the majority of places that the young people actually go and seek help or express their feelings. So again, for those of us who provide services to our young people, we need to think about maybe advertising or putting our material in this social media forum. We also asked a very important question in this survey. We asked our young people, if there's an app that is safe and secure, would you actually go and get help? And would you actually talk about things in those apps? Oh, nearly half of the young people said they would. So maybe we need to think about an app. We need to think about application in social media to encourage our young people to get help. We're going to start talking about one of the risk factors that impact on suicidal ideation. First up is bullying. And I understand that there is a film crew here wanting to focus on the topic of bullying. Just to put it out there, Panton Foundation is committed to roll out a series of anti-bullying and mental health workshops in the community to address this matter as well. More than half of the students said that they have been bullied at some point, significantly more girls than boys. And there's more girls actually admitted that they have having bullied someone in school or in the community. So we do need to think about our girls and how to end the cycle of bullying. Internationally speaking, 77% of the students would have experienced bullying at some point in their life, from mental, verbal, or physical bullying. Basically, every 7 minutes, a child gets bullied in the world. The type of bullying that our young people experience two is students were being made fun of because of their body parts, or they're being made fun of because of their skin color or their race. The type of bullying method is being left out of activities, being kicked, punched, or shoved, being bullied on social media. So those are the factors that we need to start addressing and focusing. Again, what we have done in this survey that was really helpful is to actually look at how does bullying as a risk factor impact on attempted suicide. What we found was that students who were bullied were 5.6 times more likely, maybe 6 times, more likely to have attempted suicide in comparison to those who were not bullied. Nearly 6 times more likely of wanting to engage in suicide. Bullying is another identified risk factor, as we can see. What makes child bullying unique from other types of traumatic experience in childhood is that the bullies are often children themselves. Post-traumatic stress disorder can also associate with severe type of bullying, especially when it occurs with physical and emotional bullying for a prolonged period of time. In some worst scenarios, the abuse of bullying can lead to young victims to suicide. This is known as bullycide. Even when they left school, the patterns can continue into adulthood and workplace. The victim is still at risk of the long-term effects of mental health difficulties. And that's why Alexander Foundation is bringing out a series of community topics on bullying and mental health in collaboration with the Ministry of Community Affairs in 2019. We're going to look at the factors, the risk factors, and how we can, as a community, end the cycle of bullying. We're going to look at some of the risk factors related to violence. And Kevin from Ashton is going to talk us through a lot more in depth what we actually see in our community. So I'm going to kind of quickly blaze through it and bring out the unique factors that we face within our community. 67% of our young people said that they carry a weapon in the community or in school. 67% of our youth carry a weapon. I can see some of your faces wrong. Weapons refer to objects that can cause bodily harm. The highest proportion that was reported was in Cayman Brac and Bordentown, and in Year 9 and Year 10. In terms of being threatened, we have about 7 or more % of the young people that they have been threatened by a weapon in our community. Boys were significantly more than girls for being threatened with a weapon. There's a higher proportion in the north side, meaning that our young people in the north side were more threatened by a weapon than other districts. We also asked the question of where does these young people get threatened? Where do they see violence and aggression? And where do they feel unsafe? And this is our breakdown. The sad thing is, majority of our young people, 38% of the young people, witness violence, aggression, and life-threatening events at their own home, followed by in the community and in the school. The Family Resource Center has set up a booth out there talking about positive parenting. Please take some time and visit them and get their very glossy brochure as well. And you will see why. You will see why we do need to violence and aggression in our community. In my slide now. What's interesting is there's more boys than girls when it's come to violence and aggression. And what we also ask the question of, how many of the young people has been through a life-threatening event, defining as when you felt unsafe or you genuinely feel your life at risk? One third of our population of young people said they had felt unsafe and their life been threatened in the last 12 months. The world data, internationally speaking, roughly about 38% of the young people under the age of 17 would have had an exposure to violence, internationally speaking. This is our data. Delinquency behavior. We also wanted to know actually what happened in our community. We found out that 5% of our young people has been arrested as a consequences. 10% of them actually said they have attacked someone with an intention to cause serious harm. 4% said that they have been drunk in school. 10% got suspended because of violence from school. 6% admitted that they belong to a gang or group. There's more significantly boys and girls. Overall, 67% of the young people has reported that they've been in a fight, and the most common reasons are to defend themselves, to support a friend, and to defend other members of the family. And we're talking about children here, having to defend themselves, defend their friends, and defend their families. We're going to move on and talk about physical abuse. Physical abuse were reported overall about 17% of our young people. It means that 312 young people last year admitted that they were physically abused. The pattern of abuse and violence is usually a repeated childhood experience as a parent. The use of violence as a way to resolve problems, to manage a child's behavior. So the parents often act out probably what they experience as a child themselves. And that's why the work in the Family Resource Center is so important, promoting positive parenting and ending the use of violence and aggression. Physical abuse, aggression, violence, and delinquency, and all of those antisocial behavior is definitely a risk factor. We found that students who were reported to have been exposed to physical abuse were nearly four times more likely to have attempted suicide than other young people. Sexual abuse. In terms of sexual abuse, 10% overall of our young people were reported to have been sexually abused. Significantly more girls than boys. The repeated pattern of abuse and the impact of sexual abuse can manifest internally or externally, such as risky sexual behavior, unwanted pregnancy, or becoming a perpetrator themselves, and the long-term effects, including mental health difficulties and physical health problems. Dr. Frank is going to talk us through about the impacts of abuse on the young mind in her presentation later. In terms of sexual abuse as a risk factor, we found that students who were sexually abused were 6 times more likely to have attempted suicide. any kind of abuse, we found that any kind of abuse would have contributed 4 times more likely to attempted suicide in our population. So, abuse is definitely a risk factor in suicide in our population. The last risk factor that we found to be significant in the student survey is binge drinking. The prevalence of binge drinking were about 20% in our young people. And we found that the risk of binge drinking increased the risk of attempted suicides by 1.5 times. So binge drinking is definitely something we need to address. And as Ms. Louisa was saying, that actually is one of the highest risk factors in our youth as well. Alcohol interfere with the person's perception of the reality and ability to make good decisions. And it's particularly harmful to our young people and the developing brain. So what does all of this mean? So this data, this local data, have actually taught us something. It's taught us that there are some risk factors that us as mental health profession and service provider needs to prioritize in addressing. It's also tell us that there are some gender differences when it's come to presentations and the needs of our young people. And together, we're hoping to work with our community, Mental Health Commission, HSA, and other private and non-private organizations to address these factors. So basically, the risk factors is not like a linear process. Risk factors is a circular process. When there is unmet mental health needs and the lower health-seeking behavior paired with physical abuse, sexual abuse, bullying and threats in the community, it increased the use of binge drinking as a way to manage and self-harming behavior, which ultimately impacts on suicide attempts. Because of all of these data, in 2018, in collaboration with the National Drugs Council, the Panton Foundation has implemented a series of preventative, outreach, and community-based intervention to address the risk of suicide in our population. Please stay around to hear about our plan in 2019 and visit our booth to have a look of our visual presentation of what kind of interventions we are bringing out in collaboration with the local communities. Because of this survey, we are able to tailor our intervention to our youth in Cayman Islands and address their needs effectively and directly in a timely manner. We will continue to collaborate with the National Drugs Council to collect more mental health data, and I'm hoping that I have not put Dr. Douglas off and that you will continue to help us with data analysis to help